Good evening, everyone. I am Laura Gardner, and I am presenting Role B for our presentation on anorexia. The article that I chose for this study was The Effectiveness of Enhanced Cognitive Behavioral Therapy in the Treatment of Anorexia Nervosa, a Prospective Multidisciplinary Study. The summary of this article discusses how cognitive behavioral therapy works to treat anorexia. This is a difficult condition to treat, and this is due to poor prognosis, including high rates of enduring illness and treatment dropouts. The study includes patients that are 16 years and older that are diagnosed with anorexia nervosa. The project is a longitudinal treatment study that is in a clinical setting in an eating disorder unit in a hospital. CBT focuses on the mechanisms that maintain eating disorder psychopathology, and there are four main stages to the intervention. Stage 1 is the priority stage, and this is to engage the patient in treatment and focus on behavioral changes. This stage includes personalized formulation, self-monitoring, sessions, weighing, introducing and establishing a regular eating pattern. Stage 2 is a brief transitional stage in which the therapist and the patient together review the treatment process, which should identify patients at risk of poor outcome. Stage 3 is the main part of treatment, which is to address the core mechanisms that are maintaining the patient's eating disorder, which could be underweight, overvaluation, body shape, weight, and control over eating. Dietary restraints and restriction also come from this. And then finally, stage 4 is to ensure that the implemented changes are long-lasting to minimize the risk of someone relapsing. To present this study, there are specific times of assessment. These include 3 months after starting treatment, at 20 weeks after ending treatment, 12 months after ending treatment, and when the clients had to come back, they were usually reimbursed for transportation coming back to the hospital. Weekly behaviors will also be taken into account for the results. Each client is expected to keep track of their treatment on self-monitoring sheets. Other questionnaires come about for this therapy, including depression, anxiety, physical activity logs, exercise, and eating disorder questionnaires. They also use blood and stool samples to determine the outcome of treatment for each patient. This study was done in a hospital setting, and this is important for the therapists and doctors to gain insightful knowledge on this form of treatment. These are the 4 national web resources that I'm using. I will go through and discuss a little bit about each one. And before I do that, this is my reference page for the assignment. The first website was helpguides.org, and this discusses signs, symptoms, causes, treatments for this condition. Just a lot of insight there. Also, this is from the Eating Disorder Hope website. This also has statistics, the differences in eating disorders, weight and body image, discusses treatment centers, recovery tools and support. The third is the Feeding Hope Foundation. This is just a helpline, screening tools, and more information for someone to learn about eating disorders. And the last is the National Institute of Mental Health. This just shows statistics for mental health treatments, mental health information, and also discusses where to get help as well. And it just goes through each of the disorders. Thank you very much for listening to Part B of the anorexia presentation. Thank you.